Okay, imagine this scenario. You wake up expecting, purrs and head nuzzles from your cat, but instead, you find them looking utterly miserable.
Oh, yeah.
Sneezing constantly, nose dripping, eyes all watery. It looks just like a really bad cold. Okay.
It really does. Classic signs.
This is something super common, actually. And today, we're diving deep into what the sources tell us about it. It's often called cat flu.
Mm.
Now, that name is maybe a little misleading because not like the human flu viruses we get, but it's definitely a highly contagious upper respiratory illness specific to our feline friends.
That's exactly right. Yeah. Cat flu isn't one single disease like human influenza is. It's more of a catch-all term, really, for those distinctive cold-like symptoms. I mean, affecting a cat's nose, throat, and sometimes their eyes.
Right.
And the sources point to it most often being caused by one of two specific viruses, though sometimes bacteria can play a part too.
Okay. And for you listening, maybe you've just adopted your first cat and you're seeing that suspicious first sneeze. Or maybe you're a new vet student digging into feline medicine.
Yeah.
Well, we're going to unpack the key insights from the sources.
Yeah, let's do it.
We'll look at what triggers it, the specific signs to watch for, how it spreads so easily, which is kind of scary, what caring for a sick cat actually involves, and maybe most importantly, how you can help prevent it. Okay, let's unpack this.
Sounds good. So the primary culprits, according to the sources, they account for about 80% of cases, are Feline Herpesvirus type 1, often just shortened to FHV1.
FHV1, guy.
And Feline Calicivirus, or FCV. Think of them as like the main architects of this whole mess.
Okay.
But there are other players too, like the bacteria Bordetella bronchoseptica.
Isn't that related to kennel cough in dogs?
It is, yeah. Or Chlamydophila felis. They can cause similar issues, or sometimes they pop up as secondary infections, making things worse.
So what does this actually look like? If your cat catches it, what are the signs?
Well, the signs are, unfortunately, pretty hard to miss, and very similar, like you said, to a human cold. Lots of sneezing, definitely that runny nose, and that yucky eye discharge, sometimes drooling too.
Oh.
Yeah. You might notice they're quieter than usual, maybe off their food, perhaps running a fever. A cough isn't uncommon either, or their meow might sound all hoarse.
Oh, poor things.
And what's really interesting here is how the two main viruses, FHV1 and FCV, can cause slightly different symptoms, according to the sources. FHV1 can be more severe, and importantly, it's notorious for causing these painful ulcers, specifically on the surface of the eye, the cornea.
On the eye itself. Ouch.
Yeah. Whereas FCV is often milder as a respiratory thing, but it frequently causes painful ulcers inside the mouth, on the tongue, gums, roof of the mouth.
Which would explain why they stop eating.
Exactly. That's a huge reason. And in kittens, FCV can even make them temporarily lame, so they might be limping alongside all the sneezy stuff.
Wow, okay. And talking about spread, you said it's highly contagious.
Oh, incredibly so. Direct contact is a big one, sharing saliva, eye, or nasal gunk, or even just inhaling tiny droplets from a sneeze, right in their face.
Right.
But here's a key insight from the sources. Indirect spread is also a major problem because these viruses and bacteria, they can hang around in the environment.
Okay, so not just cat to cat.
That's right. FHV1, the herpes virus, is actually pretty fragile outside the cat. Doesn't last long. But FCV, that one's much tougher.
How tough?
The sources mention it can potentially survive on surfaces for up to a month, though typically it's probably more like a week or two.
A month? Wow. So that means shared food and water bowls.
Yep. Litter boxes, bedding, toys, even your hands or clothes after handling an infected cat. All potential transmission routes.
No wonder it just rips through shelters or catteries then.
Exactly. And here's where it gets particularly tricky and, frankly, a really critical point from the sources. Many cats, especially after recovering from FHV1, become lifelong carriers.
Carriers. So they seem fine but can still spread it.
Precisely. They might look perfectly healthy, but then they can suddenly start shedding the virus again, often triggered by stress. FCV carriers can also shed for long periods.
Stress.
Yeah.
Like moving house or a new pet.
Yeah, things like that. This hidden carrier state makes controlling outbreaks incredibly challenging because a healthy-looking cat can be silently spreading the disease. Diagnosis usually starts with seeing those classic symptoms, but vets can swab for specific identification if needed, though often treatment just begins based on the clinical picture.
And because the main cause is viral, I guess antibiotics aren't the main answer.
Right. For the viruses themselves, there's no specific antiviral cure for most cases once it's established. So treatment focuses on supportive care, basically, helping the cat feel better so their own body can fight it off. Good nursing care at home is absolutely vital.
Okay, so what does that look like? Supportive care at home.
Absolutely. It means keeping them warm, comfortable, and trying to minimize stress, new places, loud noises, introducing new pets, even just being fussed over too much if they're feeling really crummy.
Makes sense.
Gently wiping away that eye and nose discharge with a warm, damp cloth is simple, but makes a huge difference for their comfort. It helps them see and smell better.
Which encourages eating, right? Since they often go off their food.
Exactly. And speaking of eating, since appetite often drops, anything you can do to entice them is good. Warming up smelly, tasty foods like sardines or maybe some cooked chicken can work wonders.
Good tip.
And steam, like sitting with them in a steamy bathroom while you take a shower, that can really help loosen congestion.
Simple but effective. And what about the vet's role?
Well, vets will often prescribe medications to manage the symptoms. Things like pain relief and anti-inflammatories, especially for fever or those painful mouth ulcers, maybe specific eye drops if the eyes are badly affected, and definitely antibiotics if a secondary bacterial infection kicks in, which is a very common complication.
Right, for those other bacteria you mentioned.
Mm-hmm. And in really severe cases, especially if they just can't eat or get very dehydrated, hospitalization might be necessary for more intensive care, maybe fluids or even feeding assistance.
Okay, so prevention sounds pretty crucial then.
It's truly key, yeah. And vaccination is our best weapon against those main viruses, FHV1 and FCV.
Do the vaccines stop them getting it altogether?
The sources agree that while vaccines might not always prevent infection completely, they significantly reduce the severity of the disease and the symptoms your cat will experience if they do get exposed, which is huge. Regular boosters are necessary to maintain that protection.
Right, so kittens get these routinely.
Yes, core vaccines against FHV1 and FCV are typically started for kittens around 8 to 9 weeks old as part of their initial vaccine series.
And beyond vaccines.
The sources really emphasize isolating sick cats immediately and quarantining any new cats coming into the household for a couple of weeks just to watch for signs before introducing them. And of course, strict hygiene, especially disinfecting surfaces and shared items, remembering how long that FCV can survive.
Got it. Wow. Okay, so we've covered a lot about cat flu, from those telltale snotty, sneezy signs that look like a bad cold, to the sneaky world of carrier cats and the crucial role stress can play.
Yeah, what's fascinating here, as the sources really highlight, is just how easily this stuff spreads, even from cats who seem perfectly fine, and how things you might not immediately think of, like simple hygiene and just reducing stress, are just as important as the veterinary treatments, which raises an important question.
Why does all this matter for you and your cat? Well, it's really about recognizing the signs early so you can get help, understanding how to prevent it where possible, and knowing those incredibly important supportive care steps you can take at home if your cat does get sick.
Mm. And thinking about stress triggering those carrier cats, it makes you wonder what unexpected things in a cat's everyday world might actually count as stressful enough to potentially cause them to start shedding the virus.
That's a really good point. Something definitely worth considering as you observe your own felines at home.
Definitely.
Okay, now, a crucial reminder. While this deep dive provides valuable information on the sources, it is purely educational content. If you suspect your cat is unwell, showing symptoms like sneezing, discharge, not eating, anything like that, you absolutely must consult a certified veterinarian.
Please do. They are the only ones who can properly diagnose what's going on and recommend the best treatment plans specifically for your cat's situation.
Exactly. This information is definitely not a substitute for professional medical advice.